Kitchen talk, conversations that cook. Kitchen talk, conversations that cook. What you want to talk about? Kitchen talk, conversations that cook. Kitchen talk, Lisa, Lopre, JT, and friends. Kitchen talk, conversations that cook. Kitchen talk, conversations that cook. What you want to talk about? Kitchen talk, conversations that cook. Kitchen talk, Lisa, Lopre, JT, and friends.
Lisa, Lopre, JT, and friends. Y'all ready to cook up some conversation? Come on.
Kitchen talk.
Let's talk. Hey.
What's up?
We are back in the kitchen for Kitchen Talk, CTC.
Conversations that cook.
Yes, they do.
Yes, they
So
do.
super excited to be here. Oh my goodness. So y'all know every week we doing this thing and it becomes more and more amazing to me. I'm super excited to be here. Thank you, France. Always hanging out, doing your thing.
You already know.
Appreciate you. I think JT may still be at work, so it is a chance that he'll pop in, but we'll see. I know he has that crazy job that we ain't gonna talk about it.
Don't do him like that. He got a job.
He got a job.
He got a job.
That we all grateful for, right? We grateful for this job.
Right.
So listen, we are welcoming to the kitchen Dr. Roberson. I am like over the top excited to have her here with us. She is the Deputy Secretary of Health for the Florida Department of Health. Like, this is a big deal for Kitchen Talk right now. Like, we got big wigs in the kitchen now. I am so super excited. So super excited to have her here with us to talk about COVID even more, talk about vaccination, tell us what we need to do. I met her a few weeks ago at a community day at my social services or Victory House, and she absolutely shined. I loved it. She answered every question, even my crazy questions, and y'all know how my questions can be. But she was like, I ain't scared of you. I'm gonna answer all these questions. Next.
That's that magic. Don't be playing.
I love it. So welcome, Dr. Roberson.
Thank you, Lisa. Thank you, France, for having me on the show. Happy to be here tonight. Happy to answer questions, have some conversations, make sure that everybody understands what we need to do to get back to some sense of normalcy and how to stay safe while we're doing it. We have Tanya that have joined us. Hi, Tanya.
Hey, this is Tanya Tatum. She comes back and talks with us about COVID. Thank you so much for hanging out again.
Thanks for having me back.
I emailed her and she was like, sure. I love it.
Got to.
I love it. How are you doing?
I'm doing well. And everybody else?
Doing good.
Great.
Doing good. So before we get started, I have a big announcement to make.
It's big.
I got my first shot on Monday.
When she told me that, I was like, those conversations started to work.
They definitely did. So thank you, Miss Tatum. Thank you, Dr. Roberson. And not just me, guys, but my sister and my niece and her friend girl. So four of us were at the FAMU vaccination clinic on Monday.
Yeah. Yeah. How did you like that experience?
The experience was wonderful. It was very easy. We just went in. We didn't need an appointment. We walked in the door. It was two gentlemen there. They helped us. They registered us, logged us in. We went over this very cute little girl. I'm sure she's a grown woman, but she was so cute. She washed her hands, sanitized, did mine. Then she started all over again. Even though she knew we were together, she washed her hands, sanitized, and then did my sister. And it was like, okay, it was like, yes. She didn't just take for granted that, even though we came together, she still did the whole process with each one of us. And the shot itself did not hurt. I felt it, but it didn't hurt. And I tried my best not to look, so I didn't watch while she was doing it, because I don't like needles and I don't like pain. But it was very easy and simple and over just like that. And then we waited our 15 minutes and then we went home. And it was very smooth.
So can I say it? Can I say it? I
What?
told you so.
Whatever.
Oh yeah.
But now the interesting part was Lorraine, her shot hurt.
Oh.
When she got it, she was like, ow. I was like, did that hurt for real or you just playing? She was like, no, it hurt for real. And like her arm hurt almost instantly, whereas ours didn't hurt instantly, but later on that night it did hurt. And I'm just getting rid of my soreness now. Like last night, early this morning. But she hurt almost instantly. Her arm hurt, but she was fine after a few hours. So, and nobody had any real symptoms. I had a little bit of a headache, but I took Tylenol and one down and one to go.
So you're a vet now.
That's fantastic. And what's great is that you moved from one place to the other and you brought others with you. I love it.
I did.
That's what
Yeah.
we need.
I did.
That is exactly what we need to move forward. So what we understand at this point in the pandemic, a lot of people that were ready to get this vaccine right away, they have been vaccinated. What it's going to take, especially for Black communities to come on board and some other brown communities in South Florida, is you're going to have to tell somebody about your story that, hey, I had some reservations too, but now I'm over it. And you're going to have to bring them along. Listen, I'll go with you. We got to take a friend. We have to tell a friend that you need to get this vaccine. There are some new variants out there. I was just talking about it behind the scenes, but we got to tell people that, you want to be protected. People are out and moving about. So get vaccinated.
And that's why I think it's important for all communities, right? I know there's a push for Black and brown, but really all communities, because as you stated, this thing is still evolving. So it's important that we all take care of each other and we look out for each other, because I'm not only around my people.
That part.
I need everybody to jump on board and do what they need to do to take care of themselves. Wear your mask the way you need to wear your mask. We kind of laughed about that earlier. You don't need to wear your mask when you're riding your bike or taking a walk or walking a dog. But when you in a grocery store, you might still want to wear your mask. What are your thoughts about that, Dr. Roberson, Mrs. Roberson? What you think?
So what I think about that, no, I do not. I'm fully vaccinated. I think people need to understand what it means to be fully vaccinated. Mm-hmm. So if you're taking Pfizer, Moderna, 2 shots, right, you're considered fully vaccinated after 2 weeks. If you take the Johnson & Johnson vaccine, which, people say, oh, I'm scared because they paused it. After they paused the vaccine, my son still got that vaccine at FAMU. 2 weeks after that, you're fully vaccinated. Then you don't have to wear your mask, if you don't want to. If you feel like you want to have some extra precautions in, you can do that. But I personally, I'm fully vaccinated. I'm not wearing a mask in public. I don't wear a mask in public or at the office. That's my personal opinion. And we do need to let people know, because some people feel like, why do you want me to get the vaccine if you're going to tell me to wear this mask for the rest of my life? So what people have to understand is that you have a big level of protection when you receive these vaccines. So you've earned that right not to wear that mask when you're fully vaccinated now.
What do you think, Doc?
Just Tanya, not
Miss
God.
Tanya. I like to call you Doc or Miss Tatum. Miss Tatum is how I really know you. But what do you think?
Dr. Roberson is absolutely right. In that once you are fully vaccinated, you don't have to wear your mask any longer. She's a brave one. I, on the other hand, I still wear mine from time to time. But I have some other health conditions. So I, had some conversations with my provider, and they're like, well, yeah, you might want to consider that. But, because of some medications I take and other things. So, I do what works for me. But I don't wear it, in the office and things like that. It's only when I'm in groups of people that I'm not familiar with or whatever. So,
right.
Yeah.
Yeah, that's how I feel too, because I don't think it only protects you from COVID, right? There's other things that are out there. You can stay away from the cold, the flu, all of that other good stuff. I think wearing the mask protects you from that. I saved the best for last because I want to know what Lisa's gonna do now that you're halfway vaccinated. You're not fully vaccinated.
I am not fully vaccinated, so I do still wear my mask. Especially when I'm out in public. I have not completely decided how. I think I'm gonna be more on the side of Miss Tatum. Like if I'm in a crowd of people that I don't know,
right,
then I may still face shield, a mask, or something. But people that I see every day that I'm around all the time, it's probably gonna be completely gone.
I see those are becoming very popular too. The face shields.
Well, you've always had the face shields.
They got them all the new design ones, I'm like, okay, y'all taking it to another level now.
Yeah, they gonna get that money. They gonna get that money now.
I saw one small kid the other day and had on a face shield that had mirrored multicolors on the front, and I was like, oh, that's different.
Wow, I hadn't seen
his face at all, but he could see out, and I was like, okay.
Wow.
I'm sure the kid loved it. Okay.
I'm sure they did.
Well, they had all kind of designer. I got a few designer ones, whatever, some FAMU ones and whatnot. But I know that even when we started wearing them, I was sick of them. So I am going to be glad to get rid of them when I get fully vaccinated. So I'm like,
yeah.
So here's a question. How do you respond? Like we're in the space where we're convincing some people like me, who was like totally from the jump, nope, y'all can miss me with that. I'm not getting vaccinated. Y'all not gonna chip me. Y'all not gonna, just all kind of stuff that I was not gonna do. And have moved to, okay. And now I've made my peace with it and that sort of thing. So what do you say to a person that is still maybe even operating at a level of fear? We'll say that at a level of fear. And in some ways I kind of was too, until I made peace with it. It was either fear of getting COVID again or fear of what the shot might do to me. And that sort of thing. So how do you speak to that person? Because I think that might be where some people kind of still are.
Let's talk about facts over fear. So you brought me to a kitchen talk late at night, and let me give you the real. We've had
that's what we want.
We've had over 36,000 deaths in Florida. We have 22 million people that live in this state. We have a lot of people, over 4 million people that are over the age of 65, a lot of older people in this state. We went out aggressive for older people in Florida. 82%, more than 82% of the deaths were people over the age of 65. Happy to report over 82% of people are vaccinated over the age of 65. You know what have happened as a result? So the proof is in what we're seeing. Those deaths have decreased by more than 85% in that population. So we know this vaccine works because we're not seeing those COVID deaths. We started out in nursing homes, in long-term care facilities, cases down by more than 70%. You can see it, you know, as vaccines went up, cases significantly went down. People that are in hospitals, people that are dying from COVID, said it before the call, a lot of those people that are in the hospital, that are in the ICU, are people that are unvaccinated. So at this point, what we have and what we're moving towards is what's called a preventable, vaccine preventable disease. That's what we're moving towards, because these bad outcomes, being in ICU, dying from this, you know, it doesn't have to be that way. When they did the clinical trials on children 12 to 15, 100% efficacy against death, that's a big deal. So children have died in this state from COVID. And if this vaccine showed us that in these studies, 100% of children didn't die, it's something to be said about that.
Yep.
Miss Tatum, what you say?
I'm right with you. I mean, the proof is real obvious for us. We know people die from COVID. The numbers are astronomical. I mean, we are almost, if not already, at 600,000 deaths across the U.S. That's just an incredible loss to us. Think of all those families and just that horrible loss. That's a lot of people. We know COVID will kill people. And the vaccine, we've got proof, as Dr. Roberson said, it works. It works. So, you know, we've got to move towards taking that chance of, you know, if I'm looking at odds, I'd rather take my odds with the vaccine than with COVID, because I've got a really good guarantee that I'm probably going to make it with the vaccine. COVID,
I like both of your comments, but it made me think of something else. You know, it's great that the state and the nation is really pushing towards ensuring that, you know, we get as many people vaccinated because we know it works, right? So, and now as you stated, you're moving towards calling it a preventative disease. But what about some of the other issues that we've had and still have pre-COVID and now post-COVID? Can we kind of move towards that in healthcare, ensuring that we can help, you know, administer either medicine, care to help a lot of people who are dying, to make it preventative versus, you know, I had a conversation just the other day, a friend who lost her insurance and almost had to pay like $300 for something that was like $20, $10 before. It doesn't make sense to me, you know. So I don't know if we can do it for COVID, why can't we do it for cancer? Why can't we do it for all these other things that are out? You know.
Yeah. So we're gonna break it on out and talk tonight. There are a lot of health services for people that are uninsured and underinsured. Let me talk to you. Yeah. So right in Tallahassee, we'll speak to the community that we're talking about. There's neighborhood and there's bonds. That is specifically for people that are uninsured or underinsured. Right. They can go there, not have, you know, any type of insurance, and receive medical services outside of COVID, dental services outside of COVID. That is what they're there for. Medicines outside of COVID. And for example, if you have a woman with breast cancer, we have a statewide breast and cervical cancer program. If a woman doesn't have insurance and they get diagnosed with breast cancer, we have a special type of Medicaid where these women can receive cancer treatment. So, people don't have to be scared to go to the doctor, if you will. We have services for family planning, for people to get contraceptives, for people to get free condoms at the county health departments outside of COVID. People can go there. Males can go there if they want, different types of services related to different things right at the health department. If people have HIV, they can go to these health departments, get set up with providers, get a free insurance for that. If people engage in sexual behavior that's risky, you can go and get PrEP, which is, they'll prescribe drugs for you. It is free at every health department, all 67 that we have in every county in this state. In Florida, we have one of the highest counts of HIV in the United States.
Oh, wow.
We do understand that some people engage in sexual behavior with other people that are infected with HIV, and there's a pill that you can take to prevent this, right? There are some new HIV treatments out because, we have to move beyond COVID and we have to see, what's going on. They released our rankings a few weeks ago again in Florida, and HIV rates in Florida is high. It's something you can do. But when we start talking about healthcare services, we got to make sure that we're encouraging people, if you're going to engage in risky sexual behaviors, this is an option for you, these PrEP drugs, and you can get it at a health department for free, no matter how much money you have. Right. So we have to tell people, if you take insulin and you can't afford it, you can go to a county health department and say, I take insulin, I can't afford it. We have an insulin distribution program, right? If you're a woman and you have a baby for the next year of your life, we have a family planning waiver program where you can go and get healthcare services for that next year if you don't have insurance. But a lot of people don't understand what it is that they need to do. If you have a child, a lot of people know this one, but a child 5 and under, you can go and get WIC services. You can get milk, cheese, eggs. You can get fresh fruits and vegetables. We have coupons for farmers markets. We're not giving you unnutritious foods. You can go to the store, pick out healthy options, and choose what you want to cook out of the fresh produce section for your family, if you meet those. And then in the summertime, we actually give more than $30, a month for you to go to a farmer's market and get additional fresh fruits and vegetables. Oh, wow. If you are underserved. So there are a lot of different programs. And then we have programs, y'all. We're going to talk tonight. Y'all want to talk? Y'all
I love it. Yes,
ma'am. This is information that's great. I think it's something that we all need to know. Like I said, if we're doing, I think COVID showed what we can do, in the midst of a crisis. But we also have to take it to the next level, going beyond COVID. What can we do more? And I know a lot of the services you stated are things that we've had pre-COVID. But, what can we do to expand those services, to give it to the people who, like you said, may not know that this is available to me? I think a lot of education is needed. We just talked about wearing a mask the right way, right? Everybody said, wear a mask. Well, how do you wear it? Some people had it up here and, not covering their face. So it's a lot that I think we can do. And I hope we don't lose out on this moment to take it another notch.
This is an opportunity. It's an opportunity. And what it's called in my world is community clinical linkages. It is what we should be doing. It is grassroots. It is not just in my office. That's why I take these opportunities at night, because, I walk what I talk. So if I'm going to sit up and write policies, look at policies, implement stuff, write grants to the federal government, have conversation with legislators and all of these things, I'm going to go in the community too. And, you can't help people and you don't know where people are. I'm going to go to churches. It's working. When we wanted the vaccine out, we went to the Black churches. We went to Hispanic churches. We went to other non-denominational churches, Baptist churches, AME, a lot of different types of churches and faith-based organizations. And what we found out is people trust people in their communities. So if this worked during COVID, what we have to understand is the same way that we got that message out, it's the same way we need to get the message out about controlling hypertension, high blood pressure, controlling diabetes, making sure that we tell people. And one thing about public health, you can't you got to give people things that they can use in a way that they can receive it. So if we're going to do something as a community in Tallahassee, there are a couple of big things that we can do. Reduce salt and sodium, control your blood pressure, get help if you have diabetes, increase your physical activity, eat nutritious things. If we focused on those 4 things, we could significantly improve the health outcomes of people, and then really focused in, here are some services to help people. If you have insurance, go to your doctor, get your blood pressure checked, get your A1C checked, find out if you have high blood pressure, find out if you have diabetes. If you have it, go to a diabetes self-management education program. Call 211 and they'll find a diabetes self-management education program for you to learn how to control your diabetes. And we, Florida Department of Health, will pay for it, because that is a service that we provide. And all you need to do all over the state is call 211 for those services. If you feel like COVID have made you have mental health concerns and you need a mental health provider 24 hours a day, you need to get somebody on the phone. You need to call and tell them, I'm feeling a certain kind of way. 211 is the number that you can call for that. So I think it is very important that we get a platform in this community. We put down a couple of things. We co-branded. This is FAMU. This is Florida Department of Health. This is, Kitchen Talk. This is, sororities, fraternities, and we're banding together. We knew what we could do if we got together for COVID, and we did it very quickly, y'all. We, in this state, quickly vaccinated 10 million people in less than 6 or 7 months. That is amazing. In 1 year, I'm going to give y'all 1 year in a snapshot. COVID, we found out what it was last year. Didn't know a lot about this virus. In a few months, we figured out you wear a mask, you wash your hands, you stand far apart, right? In a few more months, we had medications out and monoclonal antibodies. In a few more months, we had BAM-LAM, some more medications out on the market to treat COVID. Doctors and nurses, healthcare professionals from all over, they created protocols. They started sharing it. If we do this instead of this, if we give, oxygen this way instead of that way, we have better outcomes. So people figured out what to do. We figured out contact tracing. If we put it on an app, we can figure out who they've been around a lot quicker than us calling them on the phone. Next thing you know, we got vaccines. We got 1 vaccine, 2, 3 on the market. We had no testing at first. Then we had testing in a few months. We did in the United States what it would take you 10 or 20 years to do in 1 year. And if we can do it for COVID, we can do it for other things too.
Yeah, absolutely.
That's all I'm saying, Doc.
Well,
I love how you rattle. Go ahead.
No, it was perfect. I mean, because, and the thing of it is I think from where I sit, we were able to engage people with healthcare providers throughout COVID. Sometimes it was on the phone, sometimes it was face to face, but it forced that interaction and it made it a little more easy for people to participate. And I think reinforcing that, finding new opportunities to do that, certainly supporting and steering people towards our community providers. They'll sit there and go, oh, I don't want to go there. I'm like, you've got wonderful physicians and nurse practitioners and psychiatrists that work in these facilities. I know a good number of them. By all means, yes, I'd go. It's just, that's what we've got to do. You're right. We've got to take it to that next step and address some of those other health issues that we have as a community.
There's one statistic that you didn't put up, and it's one that I keep giving you praise for, Ms. Tatum, is really just getting people to figure out if they have COVID or not, right? So even before the vaccine, we needed to figure out, do you got it? Do you don't got it? And the way it was done was so, organized. Just, get in line. I think it's the same thing we could do for a lot of other things, checking your blood pressure, checking your numbers and stuff like that. I think, again, we can take it to the next level. Call 211. Call 211.
Yeah.
But absolutely. I mean, it is about community, because even through what we're seeing, we had people that came to the church that said, I'm coming because it's at the church. And if y'all are doing it, I trust that y'all are doing it. You know, I trust that you're promoting this. And, you know, even though I was spending my time with the different days and the clinics and stuff like that, and I still wasn't quite there myself, but just the fact of seeing people come and being able to talk to people, honestly, y'all, that look like me.
Right.
You know, that look like me and saying, it's really a good thing. So I think that does make a difference versus somebody that doesn't look like me saying you need to do this.
And it's also availability, right? Because you're able to go to your church and know that it's there. That's why I went to FAMU. I worked there. You know, these are my peoples. And knowing that Tatum was there, I'm like, oh yeah, I had no problems. If I did have a problem, I knew exactly who to go to.
Exactly.
You know, you got my back. That's the benefit of having that community piece.
Yep, absolutely.
And let's talk about FAMU. And you got to give people their flowers when they're doing, you know, Miss Tanya Tatum from the testing site, from the moment we set it up, the day I went out there for the testing site for vaccines, when we had that opportunity to put vaccines at FAMU, you know, without hesitation, right there, I was like, FAMU can do it. They are a trusted member of the community, and they have not disappointed. They are trusted by all communities in this county and the Big Bend area. So FAMU have done an amazing job with keeping Tallahassee safe and protected, tested, vaccinated with COVID. And, you know, we're working on a vaccine hesitancy campaign with them. They're gathering information to figure out how to get those people that may be a little bit, you know, more reluctant to get this vaccine. So I do think, and even in this pandemic, a lot of people, we've done a lot of work with historically Black colleges and universities. And we had meetings early on, FAMU, Bethune, Florida Memorial, Edward Waters, every HBCU in this state, including other universities too. I've had a conversation with every HBCU when it was time to test, when it was time to get masks, gloves, materials, when kids went back to school. We made sure that HBCUs were represented, and they have done one solid. We hired HBCU staff and students to help out with contact tracing. We put a plan in place for our Office of Minority Health and Health Equity to make sure mentorships were available, because see, we got to use this as an opportunity, right? So not only with COVID do we just want to seize this for today, we want to make sustainable changes so that we're putting diverse groups of people back into the healthcare field, teaching people about public health, you know, going into high schools, letting, you know, teenagers know you can choose public health as an option. This is what public health is. Public health is everything. We take care of a lot of people, and you can do anything from a health department, from write a contract to help babies get medications, to teach people about safe sleep. If you can dream it, it's in the public health realm.
And that's why we've benefited so much from having Dr. Roberson in the Department of Health. I mean, that's our, you know, you're there for us. And that has been such a blessing. I mean, it's allowed us an entree and a support to do the things that we wanted to do. I mean, our president came and said, hey, we want to do this. We want to be there. And we're like, okay. And the Department of Health, Dr. Roberson was like, here's how we can do it. We got you.
That's a big piece to the puzzle. You know, not only are we talking about COVID and how both of you have made a big impact, you know, in the community, but also preparing for the next. We don't know what the next pandemic is going to be. So we're literally preparing for that. And if we can learn from this, we'll be prepared for anything that comes our way and be ready to pivot when it does come our way, right? So I think it's important that we continue to educate and put, you know, our community in position so that we're ready to fight the battles when they appear. You know,
so we have a comment from a viewer that maybe one of you can address. It says CDC to hold emergency meeting after hundreds suffer heart inflammation following COVID vaccines. Are either of you familiar with that?
So they're probably talking about the myocarditis, but there are a lot of different things that people hold meetings and talk about. So at first, when Johnson and Johnson, they had the rare blood clots, and they observed that in some women through, a series of observations had these rare blood clots. They paused Johnson and Johnson in an abundance of caution to take a look at it. No different with something like this. If people see something or report something to this adverse vaccine system, the professionals will get together, look at it, and provide a little bit of guidance to see what's going on. And that's with any other vaccine too. That's what people have to understand. That's with other medications too. Even hypertension drugs, when they put those side effects up, they're still showing you that these are things that could potentially occur, but that's no different than with any other drug or any other vaccine.
Okay, thank you. Well, hey there, JT.
Hey, what's going on, y'all? Y'all all right?
Yeah.
How you?
How are you?
So
I've been better, but
You breaking up.
yeah, you breaking up.
I don't know what's going on. But but like I said, I've been better.
Yes. So you made me think of something. I wanted to say it was the 211 number.
Yes.
One of the things that I'm noticing is the post-pandemic issue, which is mental health. It's like the big hot topic. I don't know that we're seeing some issues like at the airport, at the supermarket, people not having emotional intelligence in terms of how do they interact with each other, how do we get back into schools and back into businesses. I think that's going to be a real hot topic come the fall. We had a lot of patients pre-pandemic. Now it's post-pandemic. Everybody's going to get out. It's like a traffic jam. Everybody's still trying to get out. And I don't know how that's going to affect the psyche of our community. I shared it with a friend again that to me, COVID, it was like a trauma. I see it as trauma. We had a severe trauma that happened, and now we have to get past it. What are your thoughts on that?
Well, we have a number of. I've been working for the last few years with the Big Bend Mental Health Coalition, and one of our goals was just to really address the lack of mental health services in the South Side area. That was just one of the goals that we had. So we've been doing a number of projects over the last year, but I think across the entire country, we're recognizing that there is going to be and we're already seeing a significant increase in the need for mental health services. I know even on our campus, we're hiring additional staff, significant numbers of additional staff in order to address some of the issues. I mean, when you look at it, you're right. It was seriously a trauma. We've had people that have had to change their entire lifestyle, what they did from every single day. Instead of going out or working, you had to stay home for some people. Your children may have been at home and you had to stay home and take care of them. And you may have lost your job. You may have lost a family member to COVID. You may have lost multiple family. I mean, it's just the impact of it will be seen for years to come.
Yes.
So I think, we've got a project coming up pretty soon working with barbers to give them information about mental health services and how to be advocates and how to listen and easily recommend and suggest, well, maybe you might want to do this. And I think that's happening next weekend. So I think there's a number of things. When you talked about how do we continue to keep our community healthy, that's a big piece of it. And making sure that we reduce the stigma and make it okay to seek services. That is, and then making sure we've got those services accessible. I worked with some other folks earlier last year to come up with a Black and brown providers for mental health services. So we had a roster for people who wanted to find somebody that looked like them. So there's all kinds of things that we need to do and to continue doing to keep our community whole. So, and the challenge is there. It's hitting us in the face right now. So
Yes.
we've got to step up
Definitely.
and wrap our arms around it and wrap our arms around every member to make sure that they're knowledgeable of what's available to them.
Mhm.
I'll give Big Bit 211 so much credit. They are very knowledgeable. They train all the time. We've incorporated some of our information into their training. I give them lots of credit because they cover the gamut of how they can support and refer. So
It is definitely amazing how this pandemic has brought out so much good, so much bad, so much the challenges and how we're facing the challenges and the things that we're learning to do because of the challenges, and exposing, like, really for the world where how far we are not and how far we still need to go in so many areas. Like, who would have thought, January 2020, from December 2019, December 31st, 2019, and we celebrating and we like 2020, and it's gonna be the year, and da 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 da, and we like, oh, the bomb, and then the bomb get dropped on you, and it's like, whoa, but it brought out so much. We were able to see clearly. I've been saying this for the longest. 2020 really brought us clear vision.
Yep.
Because sometimes when you sit in certain places, you don't see everything. Like, if you have health care, if you have a decent job, if you're able to do the things that you want to do, or even save up for maybe the bigger things, or
Trips.
this, that, and the other, you don't know what your neighbor going through next door, because your life all right. But this whole shutdown, you got to see that everybody ain't all right.
Yep.
Yep.
And you got to see that you're really not all right. Like, I had moments with COVID where I never thought of myself as an anxious or a person with anxiety. But when I had COVID and was dealing with COVID, I was so anxious because I was like, okay, what is it going to do to me? What am I going to feel next? Is this thing going to move in my chest? Am I going to have a respiratory issue that I can't handle? My sister gets COVID, and it's like, she got it before me, and it's like, what is it? Oh my God, what is it going to do to her? How do I prepare my mom if something happens to my sister? Just this whole thing. And you never think about an illness or a flu or a cold or whatever making you feel like this. And it brings out so much in you, but it also brought to the surface how resilient we are, I think.
That's why I said that. I think it showed us how much more we can do, right? So you said 2020 vision. It's a greater vision. I think that's what COVID is allowing us to get into, having a greater vision, having greater opportunities. And Dr. Roberson just shared it. Like, look how much we were able to do in a year.
Yeah.
And, these are things that we were trying to do for a number of years, 10 years, to get people to get checked, to go into to simple things. Wash your hands. Like, come on, these are things that you're already supposed to be doing, right? So here COVID comes, and it pushes us into a direction where we can do better. I went to I was in a facility that normally doesn't have like washing stations in the middle of the floor, but that's what they had in the middle of the floor, washing stations. I was like, look at that. I don't have to go to the bathroom, right? I can just wash my hands right here. So I think, again, this is an opportunity to take it to the next level. And what I've learned was it was not just in the health field, but it was also in all the other fields, right? Everybody had to make adjustments.
Can we talk about that a little bit?
Let's do it. Let's do it.
So one thing we know about health is education is the single most predictor of somebody's health outcome. If a child is absent in kindergarten, if they're absent and have poor reading outcomes in third grade, they're 4 times more likely not to graduate from high school. So, and these are especially important for minority and Black males. If we really want to be honest, you know, the high school graduation rates is the lowest amongst a lot of Black males and, you know, Black students in general. So if we had this pre-COVID and we were working on initiatives with different groups, Department of Education, to increase this because we understand the relationship between education and health outcomes, right? So post-COVID, it is very important this summer. It is very important that moving forward, we know that this is a traumatic event. This is what's called an adverse childhood experience. These children went through something. And they went through something, adults did too, but these children went through something that was very traumatic. So coming off of that, we need to watch their mental health, and we need to ensure that they're getting the reading supplemental help that they need this summer, the math help. And we need everybody in every community to encourage children to read, to practice their timetables, to remember to just do their summer work. We need to make these resources available. We need to encourage these children when they go back in the fall, not just give them some book bags and supplies at the beginning of the year and see them next year doing the back to school drive. We need to come up with some strategies as a community, create community resilience, and say, we're going to give you these supplies, but we're going to give you some books too. But when you have some situations where we're going to come and we're going to read to people, you know, we're going to find some reading buddies. We use Zoom for this. So if kids don't have somebody to read to them, a lot of kids got tablets. Why we can't do some read to kids through Zoom? Or some story time, you know, storytelling times, and put it on Zoom and let these kids log in and see a person that looked like them reading.
I need to put a personal input on that one. My cousin is actually doing that. Reading with Rosie Wagon, and she was already doing a reading program, but now through COVID, because of COVID, she's doing it on Instagram.
That's good.
So every Monday night she reads, and anybody could log on and listen to the stories that she's sharing. I definitely think that's what the pandemic has done. It's opened doors that we can now say, hey, there's no excuse. You know, you can learn online. You have access online. I think, again, as you talk about partnerships, here again, the state can step in and say, hey, we're purchasing books. We're purchasing access to the internet. We're doing things so that you can still, you know, be successful. At the end of the day, that's what the community is about, right?
Absolutely.
Yeah.
Absolutely.
So there's so many initiatives that we could do. And I saw one that I loved. It was from DRS, and you got to give them their props. They gave every student a laptop, and a lot of schools started doing it too. But they made sure that every student had a laptop during the pandemic, as well as every student had a lunch. So when some of the schools kind of dropped off, they stayed on it. And I love that. Again, there's no reason. I think we could continue to incorporate the two between the technology and the face-to-face. So we can't lose the momentum, right? So I'm hoping that Miss Tatum, Miss Roberson, y'all keep this push going. Keep it going, because there's so much more opportunities that we haven't even tapped into yet.
Absolutely. So let me ask a personal question. I don't think we've asked this to either one of the ladies. What made you get into this field, into the healthcare or public health field?
Oh,
okay, don't both of y'all talk at one time.
That's a good question. I mean, I think I didn't my background and my training is in biology, microbiology, immunology. I trained as a scientist. And then I found that I loved lab work, but then I wanted to interact with people more. And so then I started, did a lot of work with mental health and substance abuse. And I think I did that for about 16 years and had a chance to move back to Florida and really got into college health. And for me, working with young adults in the healthcare area and really looking at health as a holistic kind of process. It's not just about the doctor, but you got to bring in the mental health also, and you got to bring in the physical health and the nutrition, and to really look at it holistically was really, really important. And quite frankly, our young adults keep me going. They are wonderful. They keep you on your toes, but their minds are so sharp and they're so open. And that's a point in time where you can help them to create those really good habits that can last them a lifetime. You know, so that's that's where I kind of how I got in there, roundabout way. But yeah, I love it. I absolutely love it.
So, quick story about me. I'm from a small town in North Florida, Greenville, Florida, population less than 1,000 people. Really, I'm a real country girl. So, with that being said, like even today, we don't have a grocery store in that town. We don't have a doctor's office in that town. Like it is something a little bit different, growing up in the country, and that really motivated me. So, my mom worked at the county health department in Jefferson County for almost 30 years. And she started working there as a public health nurse when I was probably about 2. So my entire life, all I knew was public health from growing up with her. And the amount of stories she told us about helping people. We're going here, we're giving out food, we're giving out. I was like, I want to do that. We're going to people's houses, we're helping them learn how to take care of babies. They did a lot of house calls and stuff back in the day. They did night clinics. So, we think this stuff is new and novel. It is not. Like they were doing clinics and they were going in homes teaching young mothers how to take care of babies, going in daycares, teaching people about sanitation 20, 30 years ago. So she really, spoke to my love for public health. And then when I was in high school, you got to be careful about what you write, right? I wrote this paper and I was like, when I grow up, I want to work for HRS. That's what it was back in the day. And I'm going to public health. And I wrote this paper. She showed it to me like 2 years ago. She was like, you remember this? I was like, God, no. But you got to be careful about what you say. And then Tanya, I did my undergrad in biology and went on to do my master's and my doctoral degree in public health, but never envisioned all of this, but knew that I wanted to help a lot of people. I thought I wanted to go to medical school and almost did right after my doctorate in public health, but I wanted to help the masses. So I went into public health.
Wonderful. Yes, words definitely have power, spoken and written. So yeah, that is so cool.
Listen,
that is so cool. And we are so happy that your paths have crossed this way because honestly, I'm telling you, I'm gonna tell y'all the truth. I probably would not have gotten this vaccine had it not been for the two of you ladies. I'm gonna tell y'all the honest to God truth. That is so true. Miss Tatum, she was like, Lisa, it's gonna be okay. You could do it. Da 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 da. I'll go with you wherever you need. Da da da. And then talking with Dr. Roberson at the community day, and just hearing her passion about it, hearing her passion about us as a people, and the things that we, are leery of, and just being willing to answer all of those questions. It just gave me such a peace to know that people that I'm the type of person that I can feel a vibe and know whether this is a good person or not so good person. And just being around you all, it was just peaceful. And I'm like, I believe I could trust them. And that was just how I felt. And I trust what you were telling me. And it just helped me make the decision. And the fact that I had people who were waiting on me to make the decision. Like my sister said, I don't want to do it. But if you do it, if you decide to do it, I trust you, I'll do it. And you never know who you're linked to in that way. You never know. And so my niece was like, well, Auntie, if you're going to do it, then I don't want to do it. But if you're going to do it, then I'm going to do it. And her friend girl. So it was, you just don't know. So I appreciate you guys so much for being open and being in these positions of power and these positions of compassion.
Yep.
It is so wonderful. Just the fact that you say, hey, I'm not just telling you something. This is something I did. You know, I got vaccinated. I'm up. I believe in this. And knowing that, I think that made the biggest difference for me. And I appreciate it so much. And I am waiting on my second shot in July. I get my second one in July. But I went and got the first one, and I was all right.
I think that the greatest piece.
So I'm going to make sure I'm there for the second one in July. Okay.
Okay. I'm going to call you.
I think the biggest piece tonight was even just that, Ms. Tatum, is all of you are women of change, right? You're here to change, make some changes. When Dr. Roberson told me that she had received that position, I said, oh, we're going to have some change happening. I told her, y'all don't know what y'all about to get. What's about to happen? You know, I've known Miss Tatum for years, and you know, just knowing that her heart is really into helping and teaching and working with students, but more important, educating, right? Because it's gonna pass on. So, Lisa, it's what you just stated. It's being change agents. And here's an opportunity. When it shows itself, we need to take full advantage of it. So,
absolutely,
like I stated earlier, I can't wait to see what happens next. Right? How much more we can push the envelope and take it to another level.
Absolutely, I'm looking forward to that too. So
there, and the compassion and the heart's there to do it. So I think we'll see some good stuff.
I know it. I know it. I know. I'm gonna write it down. That way we know it's gonna happen.
Absolutely. So, in our last few minutes, and we'll go with you, Ms. Tatum, first, and then you, Dr. Roberson. If this is your last plea to get the vaccination, what do you say to them?
It's the one thing that you can do to take care of yourself and to take care of your family.
Yep.
And to help your community.
Yep.
And you've got a lot of people to walk that walk with you. And we'll be there for you. That's it.
I love it. I love it.
Dr. Roberson?
What I'll say is the outcomes from COVID-19 is far worse than any risk that this vaccine could ever give you. And by receiving this vaccine, at first, you know, we didn't have the numbers to show it, but we have the numbers to show that this is significantly different than us not having a vaccine. So when you take this vaccine, like, you're giving yourself life, you're doing it for your family, you're doing it for your friends, doing it for your community, because, you know, we have to come back, and we have to come back, like you both have said, everybody on this call, better than we left before. And the only way we're going to do that is with this tool that we have added to our toolbox. And this, coupled with a lot of other things, will get us there. And we want to create that sense of community resilience. And, you know, COVID, you know, we had a lot of tragedy in this, but we have a lot of opportunities in this too. So we have to seize the opportunities that we have. And the way that we really push our communities forward at this point is that we're healthy. And now that we're out of this, we understand that the next pandemic, when there's one, if there's one, the most basic thing we can do is, if we're healthy, you have better outcomes. And we saw that with COVID, and it's true in everyday life. heart disease have been the leading cause of death in the United States for the past 20 years. And we haven't seen people really jump on the bandwagon to try to make it better like we have with COVID, diabetes, stroke, those things, cancer, leading causes of death in the United States and in Florida. So with this type of momentum, if we can see a change in a year with COVID, we can begin to see a change in a few years with heart disease, with cancer, with diabetes, with stroke. And I think this gave us the platform. This paved the way for us to show communities that we can be resilient and we can do a lot better with these other things too. So I want us to seize this moment, get vaccinated so that we can move forward with life.
I love it.
Facts over fear.
Yeah,
Absolutely.
You said that, I was like, oh yeah.
Absolutely.
Facts. That's all y'all give us tonight. So definitely facts over fear.
Appreciate you guys so much. Thank you for hanging out with us. And like Miss Tatum always like, yep, I'll be there. I love it. She's been hanging out with us for like the past 3-4 months. We've been like, can you come talk to us, tell us what's going on? So I appreciate it so much. And our new Kitchen Talk friend, Dr. Okay, so I got to have you say this. Please pronounce your first name for me.
It's Shamarial.
Shamarial. Okay. I was like, I'm not going to try it because I don't want to mess it up. Shamarial.
It's very pretty.
I love it. Thank you for hanging out with us so much. We really, when I say we appreciate it, I mean,
Thanks for having me on. Yeah. I really appreciate it. I love this work, so invite me back and I'd be more than happy to come back.
Oh, well, now you done told us, so you got to answer the phone when we call.
I will.
Thank you.
I love it.
Thank you guys.
If you are watching us on YouTube, hit the subscribe button so you'll never miss another show. If you are watching us on Facebook, hit the like button. It gives you alerts of when we're on as well. We will be back. JT and France. Thank you. We'll be back next Thursday, and it's going to be a good show. The guys think that I'm not coming because we're doing a Father's Day show to celebrate our Black fathers. I'm going to be here.
You need to be here. We need that.
They kicked me out the kitchen the other week, so France said I was on vacation, but he told the people that they kicked me out.
Got to go.
So we'll be back next week talking and celebrating our fathers and pre-celebration of Father's Day next week. So y'all come back and join us next Thursday, same time, same station. We love you. We appreciate you. And we will see you all later.
Thank you.
Bye.